My name's Heather Adams, and I'm an associate professor in the physician assistant department at Gannon University. I received my undergraduate degree in biology from the University of Pittsburgh in 2001, and then in 2003 I received my master's in physician assistant studies from Chatham College, now Chatham University. My clinical experience includes work in neurosurgery, cardiology, and women's health. I have experience caring for patients in both outpatient and inpatient settings, including emergency department, surgical suites, intensive care units, and telemetry ward. Early on in my clinical career, I developed an interest in teaching, which really sparked from precepting students on their clinical rotations. In 2011, I became an adjunct instructor for Gannon's PA program, and then in 2013, I was hired as a full-time physician assistant faculty member. Since that time, I've worked as a clinical coordinator. I've taught students in the freshman year of the class, juniors, and the bulk of my teaching has been in the professional phase of the curriculum. I come from a long line of educators. I'm a fifth-generation educator, so I'm proud to be passing on my knowledge to future students. I also continue to work clinically 1 day a week in women's health at a practice called Women's Wellness and Gynecology here in Erie, Pennsylvania. In the classroom, my passion isn't much different. It's just focused on the students. I try to bring medicine to their level, helping them to learn it in a fun and energetic way. I try to motivate my students to be lifelong learners. I found that both of my roles really complement each other. In my clinical setting, I'm engrossed in evidence-based medicine, best practice, and that allows me to bring that information back to students in the classroom, making medical topics more relevant for them. Also, in the classroom setting and in PA education, I'm engrossed in medical theory, which allows me to be a more knowledgeable healthcare provider. In the classroom, students can expect to have a relaxed classroom, but a fast pace. We have a lot of material that we cover in a short period of time, and we make it as fun and interactive as possible. So I like to incorporate classroom discussion, student questions, and class participation. I also like to relate class content back to my own clinical practice. I believe that this makes the information more relatable for the students. My training was largely based in problem-based medicine, so I like to incorporate clinical case studies and critical thinking activities, problem-solving activities into classwork whenever possible as well. I try not to shy away from controversial medical topics, but rather give the students tools that they can use to understand those topics and the impact that they have on patients. I believe that physician assistants have an important role in the future of healthcare, and I am proud to be among those who are educating the next generation of physician assistants.